Welcome back here. Over 7 million people in the U.S. are considered immunocompromised. While COVID vaccines protect most people from developing severe disease, immunocompromised people do remain at high risk of complications, hospitalizations. Now, Julia Moore-Vogel, she's a program director at Scripps Research Translational Institute, joining us this morning. Hello, Julia. Good to see you.
Good morning.
So you are part of this study that was looking at people who are immunocompromised. Tell us about what you've been looking into and the importance of this when it relates to COVID.
Absolutely. So we are focused on the immunocompromised individuals that have about a 20% chance of being hospitalized if they get COVID, which it's hard to believe with so many people feeling like their risk is really low that the risk is still that high for a large proportion of individuals in the U.S. And so we're really focused on ways to try to, one, prevent infections in this population, and then two, get them treatment really quickly if they do get infected.
And over 7 million people considered immunocompromised. So tell us about that. Who are these people? What have they been going through? People who have prior disease? I mean, what are you looking at?
Yeah, there are a number of different diagnoses. It could be people who are undergoing cancer treatment, for example. We know how chemotherapy can really decimate the immune system, people with HIV infections, people who've received transplants where you really need to keep the immune system sort of dampened to avoid the body rejecting the transplant, different indications like that that really affect the immune system's ability to respond to an infection.
And I know throughout COVID, obviously, those are the people who had to isolate the most and kind of, obviously follow these precautions as much as possible. So tell us now with this study, as we're getting more information about COVID, what are you hoping for them? I mean, is there hope that they can kind of get out into the population a little bit more?
That's the hope eventually. Right now it's a really challenging time, especially the FDA just stopped approving Evusheld, which was used as a preventative monoclonal antibody for the immunocompromised population. And so the CDC just released guidance saying they need to take more precautions right now. So it's a really challenging time for immunocompromised individuals. So our goal is to use nucleic acid amplification tests that are manufactured by Q Health here in San Diego to try to catch infections really early in those that are immune compromised so that they can get treatment really early. They can use Q's telehealth services to get delivery of drugs like Paxlovid on the same day that they call in and that they test positive. And then also to have others in the household of the immunocompromised person be able to test and hopefully if they get infected, isolate soon enough that they don't give it to the immunocompromised person. Okay.
Yeah, because obviously people in households can spread it quite rapidly, as we've learned. So you're still taking part in this, or people are still in this study, right? Are you still looking for more people to kind of do this research on?
Absolutely. Anyone who's interested can go to immunocare.scripps.edu, and the whole study is online, remote. The tests get sent to your house, so you can do everything from the comfort of your own home, and all the information you need is there on the website.
Okay, and as far as what you're looking at for people who can participate if they're interested in doing so, what would some of those requirements be?
Sure. So you need to have your first series of vaccines. You need to be able to share claims data with us, which is basically all of the health care that you seek gets put together in claims. And that's so that we can track whether you are hospitalized or not from COVID-19 without you having to actively tell us when you're in the hospital that you've been hospitalized. And you need to agree to share your information and complete monthly surveys.
Okay. And this is all happening here locally, Scripps Research, but you're also looking at people nationwide, is that right?
Absolutely. Anyone nationwide can join because it's a fully online study. You just go to the website and participate from there. Okay. So feel free to tell your friends even if they're not in the area.
Okay. The end goal to help people who are immunocompromised so they don't end up in the hospital as often. Thank you so much, Julia.